as a yoga teacher or a yoga therapist, can evaluate an appropriate range of motion and therefore an appropriate set of physical practices for your students' bodies, and how to determine with very simple techniques how particular body types are more naturally inclined towards certain poses and certain ranges of motion, and how other body types are more inclined toward other ranges of motion. A lot of this needs to be done after many of the very tight issues have been erased from a little bit of dedicated yoga practice. So what I mean is, on beginners, some of these things might not be as effective as on people that have an established yoga practice. However, if you as a yoga teacher are wondering, does my student have the ability to do this pose or that pose, then this might be an effective way for you to evaluate it. What we're going to do on these two very different bodies is evaluate where their hips naturally want to go, what the appropriate range of motion is for the hip, and also what the appropriate range of motion is, and I say appropriate, but it could be many things, but what their natural range of motion is for their knee. The reason that we want to do this is that some poses, for example, poses in which our hips are in external rotation and our thighs are in abduction, so poses like Baddha Konasana, poses like Janu Shirshasana, and even poses like Ardha Baddha Padmasana, half lotus, are very easy for some body types, but other body types not so much. So this we're going to evaluate, is it a bone-on-bone compression issue, or is it perhaps that their muscles are a little too tight and are impinging something? Or is it instead that the way their femur actually sits in the hip joint, the acetabulum, that is prohibiting this external range of motion? And so what you'll find is some body types very easily come into poses in external rotation when the thighs are in abduction. So I'm a body type that naturally can go to this extreme external range of motion. So in Baddha Konasana and butterfly, for example, in Upavishta Konasana, where the legs are wide, for example, I can easily bring my chest forward and fold. Other people have a very hard time with that, yet they're much more inclined to be able to sit on their heels, like in Virasana or Vajrasana, and in fact, many people can lie back very easily. So we have kind of two natural ranges of motion, external rotation and internal rotation. And while all of us have the capability to do each of those ranges of motion, certain body types are more inclined to that. So what we're going to do in this evaluation is really, and I'll show you on the skeleton here, is evaluate whether or not we have some bone-on-bone compression. So in external rotation, where we tend to see the compression, is this little bump of the femur on the inside called the lesser trochanter against either soft tissue or against the lower part of the pelvis, right? So we tend to see a little bit of compression there. We might also see compression, if they're in extreme range of motion, in the lesser trochanter against the upper portion of the pelvis, the ilium. Right? And where we're going to see compression on internal rotation is this greater trochanter against some portion of the bony pelvis. Sometimes this is soft tissue and sometimes it's bone on bone, but it's imperative that we as yoga teachers understand that every person's skeleton is somewhat unique. And certain skeletons are more inclined for certain poses. And what we want to do with all yoga is create evenly mobility and stability. And if certain people have a lot of mobility, they need to learn how to stabilize their skeleton. Other bodies have a lot of stability, and so they need to learn how to create more mobility in their skeleton. So this is the dyad that we're always working with. So we'll start with Kathy here, and all we're going to do is have our student come forward toward the edge of a chair. We're going to help them lift one leg, and we want to make sure that we're working with the more open side, so it gives us more an idea of their natural range of motion. And then I'm just going to gently hold her foot and take my other hand to her thigh and begin to take her leg in external rotation. And so what she'll feel is after a certain point, she's going to start to feel compression. And so where do you feel the compression? Right about here. So they'll feel it right up about the inner groin. So this can be soft tissue or it can be bone. But this tells me that this is Kathy's natural range of motion. So now we'll try internal rotation. And she doesn't have a lot. You can see that she's trying to lift her hip away from the floor, right? So Kathy might have a little bit of difficulty in a pose like Virasana, right? Particularly where then we might ask her to lie back, even if there are props beneath the hips. However, in a pose like simple cross leg, or butterfly pose, or even something like fire log pose, Agni Stambhasana, or its variation, seated pigeon, she might be very inclined to come into these poses in a comfortable way. So now what we're going to look at is how much natural range of motion does Kathy have in her knees. Because we're all women in this video, and women's bones tend to be smaller, and therefore have more natural mobility at the joint sites, we want to be very cautious that the knees aren't moving to accomplish what the hips are not open enough to do. So what I mean is, if my hips are very tight, and I come into Lotus pose, or a variation of Lotus, when my hip starts to tighten, when it stops releasing, if my knees have a lot of lateral rotation, which is normal in most women, then the rotation for this shape is going to come from my knee and not my hip. So I joke that some people have Lotus legs and some people do not, right? I have a lot of external rotation in my hips, but I also have a lot of lateral rotation in my knees. That combination makes it very easy to come into postures like Lotus, but it destabilizes my skeleton and can cause additional knee pain. So we'll see if Kathy has Lotus legs or not. So you'll have your student lift their leg, flex their ankle so their foot is very stable. You'll hold on to their foot, make sure that they stabilize their thigh, and then we'll take the foot out to the side. So Kathy does not have Lotus legs because what her body is telling me is that there's a lot of natural range of motion in an external way. So when her hip stops to release, her knee will take the remaining force. So this is prime injury site, right? So if Kathy practiced Ashtanga Yoga, we would have her skip the Lotus postures. Now, Ashtanga Yoga is pretty vigorous, but this even applies to postures as simple as seated cross legs, right? If your clients have a lot of natural lateral rotation in the knees, and you have them come into simple cross leg, and their hips are also very tight, their knees are going to take some of the gravitational force downward. So in that case, we would want to prop their hips up a little higher so that the hips can soften and release without the knees taking the force. So now we're going to look at Sonia. And Sonia might have a similar body type and a similar mobility issue, but she might not, and so we don't want to assume. So we also want to make sure that we're working with Sonia's open side. So which one is your more open side?
This side.
This one.
Yeah.
Okay?
Probably the left.
No, okay. So we'll come back to Sonia, and again, we'll have her lift her leg up. Holding on to her foot, we're going to take the thigh out into external rotation as far as it'll go. Now, Sonia doesn't have a lot of external rotation. So, I know Sonia's body, and I know that part of this is because she has a little tightness in her inner thighs, her inner adductors, right? So that could be happening, but I would ask her, where are you feeling the most compression?
Up in here.
Outer thigh and top of the thigh, right? So that's also telling us that yes, maybe she has tight thigh, tight inner thighs, but we also might have a bone-on-bone issue as well. So now we're going to go to internal rotation and see where Sonia wants to go. So we can roll her femur in, not a lot, but a little bit more, say, even than Kathy. she has a little bit more comfort in an internally rotated posture, which means that she might be more comfortable in something like Virasana, or one leg forward and one leg folded back. Right? So all of these things, this range of motion assessment, simply gives us an idea of what might be happening in our client's body. Why might this student not be able to fold forward with their leg tucked back? Why might the student not be able to do Janu Shirshasana without pain in their knee? Right? So we want to be able to envision what the skeleton is doing while also maintaining, obviously, that certain muscular forces are acting on the skeleton itself. So now we'll see if Sonia has lotus legs. So we'll have her lift her knee again, energize her foot, so flex the ankle, and then I'll have you stabilize your thigh here. So now we're going to roll the tibia laterally to see if she has a lot of range of motion. And you can see compared to Kathy, she really does not. This is about 15 degrees of lateral rotation. Kathy had about 45 degrees of lateral rotation. This is fairly normal. So Sonia's body might actually benefit from a little more vigorous practice with Lotus or Ashtanga yoga, things like that. Right? So there's not a lot of range of motion at an interior way. That's generally the case. But the one that we really want to be cautious of, since knee pain is such an issue for yogis of all ages, is definitely where is this motion coming from? Because again, when the hips stop releasing, the knees will take the force. So a lot of times people have knee pain because of inappropriate biomechanics in their hip, right? Whether on the mat or off the mat. So all of these things together give us adequate tools for assessing what is the appropriate practice for our client's body type. Every body needs something slightly different. So whether you're a yoga teacher teaching group classes, or a chair yoga teacher teaching chair yoga, or a yoga therapist fitting the practice to each individual person, it's imperative that you understand that certain skeletal constraints will inhibit how your body looks in certain poses. And those skeletal constraints also need to be taken into account when devising a practice that restores harmony to the body. So by harmony, I mean gives mobility where there is stability, and gives stability where there is mobility. So I hope this serves you. Again, my name is Kellie Adkins. I'm the founder and director of the Wisdom Method School of Yoga, a therapeutic yoga school that teaches trainings nationwide. Thank you so much for watching, and namaste.